the other earring, and I was like,
I know, it looks good though. It works out.
fuck it.
Alrighty, bonjour et bienvenue tout le monde. On behalf of Fourth Space and the new initiative, welcome to Black Community Health Check. We are streaming on YouTube live from Concordia University's Fourth Space, located on Antira Indigenous lands in Tiohtià:ke, Montreal. Nous reconnaissons la nation Kanien'kehá:ka comme gardienne des terres et des eaux sur lesquelles nous nous réunissons aujourd'hui. And we make this acknowledgement to bring awareness and understanding of the history of Indigenous peoples and their territories, and as a call to rethink one's own relationship with the city, the land, and environment. At Fourth Space, for those of you who are joining us for the first time, we collaborate with our university community to bring people together around the various initiatives, dialogues, and projects that are in development across the university. So to that end, it's been our absolute pleasure to have collaborated with Annick Maugile Flavien to host this week's series of events focused on Black community health. We're so excited to have Marlihan Lopez back in Fourth Space with Annick. So without further delay, over to you both. Welcome.
Hello, everyone. Thank you so much for that intro, Anna. I just want to start by taking a moment for the National Truth and Reconciliation Day. Yeah, let's just have a moment together. So this week, we've been having conversations around Black community health. My own personal investment in this conversation is because of my PhD, and I'm looking at Black community health, particularly with a focus on caregiving and the role that it plays in kind of facilitating our access to healthy lifestyles, healthcare, and so on and so forth. And I have been bringing in experts to talk about the different areas in which Black community health exists, right? So whether that be in health institutions, in homes, in community, and so on and so forth. And you've done so much work in community, so I'm really excited to have you here today, Marlihan. I'm just gonna read your bio to start us off. Marlihan Lopez is a Black feminist community organizer tackling issues around anti-Blackness, gender-based violence, and its intersections. She coordinated the EDI division of the Quebec Coalition of Rape Crisis Centers, where she did advocacy work and raises awareness on how gender, race, class, and ability intersect with the context of sexual violence. She has also organized with movements such as Black Lives Matter around issues such as racial profiling and police brutality. She was vice president for la Fédération des femmes du Québec and is currently program and outreach coordinator at the Simone de Beauvoir Institute. And she is also a co-founding member of the coalition to defund the police based in Montreal. Also happens to be a sister from another mister for me. so happy to have you here today. Can you tell us a little bit about the community advocacy work that you're doing right now? I know that you have had such a long history of different types of community work, whether that be around sexual violence, rape crisis centers, but also defunding the police. So can you tell us a little bit about what you're working on, like where's your focus these days, and kind of what brought you to this path of community advocacy?
Thank you, Annick. So recently I've been doing a lot of work around organizing against sexual violence in terms of prevention, but also around organizing against policing and police presence in schools and elsewhere. And so a lot of times those two intersect, because in terms of the work that I do around preventing sexual violence, we're working with folks that are trying to reimagine prevention in terms of not centering carceral or punishment when trying to do popular education and raise awareness around what makes folks vulnerable to sexual violence and how to prevent it.
I love that, so much of your work is around prevention, education, and kind of changing systems in which we work in, really. And not just at institutional levels, but I think that you do a lot of really interesting grassroots thinking about where we're at and what we actually have as resources within our communities in order to be able to do that building up work. When I was thinking about what I would call this week of conversations, and I came up with the term, Black community health as like the term to work around. It was really interesting because, all of those words are very contested, right? Like there's so many definitions of what Black means, there's so many definitions of like what health means, and then of course of what community means. And I would love for you to kind of guide us in what your understanding of community is, because I feel like it's a very, like your vision of that is really important in the type of work that we want to do if we're thinking about Black community health as like a local or even global issue.
So there's a lot of parts to that question, but let me just try to address some of them. So for me, like I'm a migrant here in Quebec, Tiohtià:ke, Montreal, and so I come from the Caribbean. So for me, community means something totally different than what a lot of people might think of community here. In an institutional sense, a lot of people think about community when they say we need to invest in community, they think about community organizations. But I think community exists outside institutions, and unfortunately, the systems that oppress us have made it so that community doesn't have the same presence, power, and that's the type of work that I'm interested in doing, is building that community that I so long for, that I miss from back home. And I think in terms of tackling the issues that concern me or that I work on, it's important to have that community, present. And we can't just rely on institutions, because a lot of those institutions, even though if we invest more in them, they continue to fail a lot of people. Whether it be, if you talk about service provision, community organizations do a lot of service provision, but there's a lot of bias within community orgs and a lot of barriers to accessing services. So we need to see beyond, what people call the industrial complex of the NGO sector. And so I think it's important for organizers to be building community. And so a lot of the work that I strive to do centers that, whether it be around sexual violence and raising awareness, popular education, or whether it be around policing, talking to folks and, having conversations on what security is to them, what makes them feel safe. And, if we're in the context of the work that I do against policing, or the work that I do with the Coalition to Defund the Police, if we are to defund the police, we need to have healthy communities. We need to have community responses to violence. But if there's no community, who's gonna be there to respond? If we don't know who our neighbor is, how are we gonna intervene? So I think there's a lot to be reflected on in terms of what community means to each one of us. And we need to, I would hope that we have a less individualistic view of what we view as community, and that we do the work and plant the seeds necessary so we can have healthy communities here in Montreal and elsewhere.
And so what would be the core elements, if you were to think of a couple of core elements of what community is it space, is it people, what are some of the core things that you're looking at that are maybe different than kind of having a bunch of organizations that maybe serve community, but then what is the actual community for you?
So it has changed and evolved in the years, and in the context of where I do live in Canada. And it's difficult. It's difficult to know who lives around you. We live in a totally different system of values. And back home it was much simpler. In terms of policing, back home nobody calls the police because everybody knows their neighbors. And if there's a problem, and during the pandemic, a lot of times we talked about mutual aid. Mutual aid became so important. And I think we were onto something. I hope.
Maybe
I hope it continues. But mutual aid, in the Caribbean and in the countries where I've lived, it's something that's integrated in our values. Like just recently there was a hurricane that passed and I called my mom and like, oh, I'm okay. The neighbor brought me food. Oh, like they have electricity, I don't, so I gave them my food so they could, like there's that, you know, care. We care for one another and we don't necessarily always like each other because, you know, I know that my mom
a little tension with your
but
neighbor.
it doesn't even matter. Like you can have beef with your neighbor, but you know who your neighbor is, and if there's need or you know there is that, there aren't those barriers. You can really reach out, and people reach out to each other even though they might not necessarily. It's like an extension of family. Like we don't always like all our family.
Yeah.
And we don't always spend a lot of time with our family, but if you see someone that, you know, needs help, it's not like we don't call, you know, there's a system of care that's present, and when that system of care is not enough, that's when we go out to institutions, and that's when we go out, but there's that like system of care that is there, and that's something that's missing here, I find, in our communities, and that's something that I think it's important to develop if we're gonna really tackle the issues like at hand and social problems that affect our communities.
And so when, you know, if we expand that and start thinking about Black community health, so what would Black community health mean for you in this particular context where we know that when we're talking about Black community, we're talking about a very diverse, you know, like plural of what Black communities is. And also that, you know, geographically we're kind of spread around the city or the country in different places. We have language barriers, we have isolation, we have all of these other things. So when you're thinking about Black community health, like what are some of the things that you're thinking about in this context?
I think there needs to be spaces to develop sense of community within Black communities. We do have a couple of community orgs, historical community orgs that continue to do important work. I think we need more. I think we need to invest more in those that already exist. I think we need to invest in Black-centered education. I think we need to invest in Black-centered mental health. You know, a lot of people will be critical and say, oh, you know, here we don't do those divisions. You know, our services are for everyone, but you know, we see that it's not the case. So, you know, the social services, health services aren't for everyone, and a lot of Black folks face discrimination, bias when they go to the doctor, when they go to the psychologist, when they go to school. So we need organizations to support and accompany folks. We need organizations to support and accompany folks, our elders, for example.
Yeah, for sure.
But we also need resources. So like I said before, there is a baseline where we can be there for one another. And it is difficult because we're spread out, and you know, there's not necessarily big pockets of, you know, neighborhoods where a lot of us all live. But, you know, we need to find ways in which we can care for one another and, you know, fight for organizations, you know, community organizations that can advocate and have resources to accompany folks that, you know, need support.
What you said earlier about how, you know, there is this argument of like, oh, well, we don't divide things here, or like we don't see color here, or we don't, whatever the narrative is. I think that often that's like kind of the rebuttal, but there's, without acknowledging that there's really significant social disparities that impact our communities in ways that it really doesn't impact other communities, or in ways that may be different than other communities. In the work that you do, whether that be around police violence, sexual violence, and so on and so forth, where do you see these disparities happening? Like, what ways do you find that the Black community has really different experiences than other communities?
Everywhere. Like, in terms of children, their first experience of racial profiling is in schools. And there's groups on social media of Black mothers where they share their experiences, and they're horrible. You know, you hear all these experiences Black kids have in schools, how they're over-disciplined, how they're punished more than their peers, how they're, you know, policed more. And also the lack of services that are available. You know, a lot of our kids with, you know, disabilities or challenges in learning don't have any resources, or there's no programming to accompany these kids and support them in learning. And so what happens is, you know, our dropout rates are much more higher. And you know, in the context of children that have disabilities, when they're in closed classrooms, they end up finishing, not even finishing, but, you know, they end up being 18 and there's like nothing. They just age out of school without a diploma, without any, you know, plan for the future, and then they're in the streets. And then we can't be surprised if, you know, there's social problems that affect our communities after. We can't be surprised if, you know, kids get into trouble if there's no programs to address and support their needs. And so that's just schools. If you go to health, you know, I have to tell people in my community, especially elders, if you go to the doctor, try to go with somebody else, you know, always be accompanied. Like you shared with me once your experience when you were in labor, you know, just black women giving birth in hospitals here, and, you know, the dangers and the vulnerabilities they face in hospitals, you know, in the health system. And so it's everywhere.
Yeah, for sure. No, and you know, this idea of like the buddy system has literally come up in every single interview I've done this week, of like how we are constantly, as Black people, having to go into spaces with another community member in order for us to be hopeful that we won't have a horrific experience, right? So like that is not, it's not just like, oh, you know, have a buddy so that you can remember the information, etc. It's like you bring a buddy for safety. And I'm really, it's interesting because it touches on the work that I'm looking at in terms of caregiving and how much of extra labor we end up having to take on, because we often have to be that advocate for another friend, an elder, you know, a sibling, and so on and so forth, while we're also still experiencing this violence ourselves and still trying to work it out and still don't have the full answers, and et cetera, but yet we have to go and be an advocate for someone else. Can you talk a little bit more about the work that you're doing in terms of defund the police in schools? Because I think that that's such an important first space where our children are learning that they're Black in a very different way that they might be learning that they're Black in homes, right? And having to then think about their wellness in really racialized ways.
So the coalition to defund the police has different committees, and one of them is they call Sans Police, and there's youth, there's teachers, there's organizers that have been organizing within this committee since the beginning of defund. And recently, last week, the government announced, the city announced with the SPVM $4 million to fund a program, École, which is they call a multidisciplinary équipe, how do you say équipe? Team, where you have criminologists, you have police officers and others. And they're going to be going into schools, schools where they say there's violence. And what they've said is that it's going to be like on a voluntary basis, like the schools have to call them and then they'll mobilize. But the thing is, you have to look at schools here. They're talking about going to schools where, you know, there's issues, and it's mostly schools in very racialized neighborhoods. And so if you go to those schools in very racialized neighborhoods, whether it be the English School Board or the French Centre de Services Scolaires, my kid has gone to over 4 schools, maybe 4 or 5 schools, and it's always the same thing. The teachers are overwhelming, like the majority are white. And there's like, I think my son has had 1 Black teacher, and he was lucky, 1 Haitian Black teacher, but the rest have all been white. And so a lot of, you know, unfortunately, teachers come with biases. They don't know necessarily how to address, you know, the challenges that our kids face in schools necessarily. And then you have the fact that the direction of the schools is almost always white. So you can't, you know, I don't think parents can be very comfortable thinking that the first reflex of the school principal or the direction or a teacher is going to be, I think we should call the police. Because unfortunately, they don't understand the needs and the challenges our kids face. And since schools are underfunded, teachers are underpaid, there's a lack of resources, it doesn't give them much options but to call the police if there's conflict or a case of violence. So we're mobilizing, because a lot of parents don't even know that this program is being deployed. And so we're mobilizing within different communities here in Montreal and different neighborhoods to raise awareness on what this program means, and also to look for alternatives like programming around transformative justice, restorative justice. There's a lot of schools outside of Quebec that have these types of programs to address violence within youth in the schools. So why can't we fund these types of programs instead of funding, you know, more police officers and in schools? You know, schools should be a place of learning, a place where kids feel safe. So the team is, the École Sans Police is doing a lot of work, raising awareness and mobilizing folks around this issue.
I appreciate the lens that you're bringing to the table right now, because so we had like a public conversation yesterday where we were stopping people that were walking down the street and asking them, you know, what does health and wellness mean for you, and so on and so forth. And one of the people that we chatted with was saying that, you know, feeling safe and valued in spaces is a form of wellness for me, right? It's not, I think that often when we say the word health, automatically we think about the biological aspect, or sometimes now a little bit more of the mental aspect, because that's been, like mental health has been at the forefront in a lot of different ways. But we also don't think about, you know, what does it mean to like even feel socially accepted, to know that you can go to school safely, and so on and so forth. If you were thinking about, you know, wellness, like I know you have a school-age child, and the types of spaces that, like, as soon as they leave our home, you know, we have, like, I mean, I have a sense of heightened anxiety because, like, I know what that can mean for them, right? And so when you think about Black community health in these types of spaces, what are you hoping for your children and for yourself?
So I think if we're to talk about Black health or Black community health, we need to get folks to acknowledge that racism, that, you know, policing, surveillance, all of this has a huge impact on health. Like, but it's not been acknowledged. You know, a lot of folks in our communities are sick, not just in terms of mental health, but physically sick, high blood pressure, diabetes.
Alzheimer's,
you know, it's just
all kinds of
Black
stuff.
folks that do, like Black folks in medicine that do these studies and do research on this. It's been studied, and folks have said in the medical sector that it has a huge impact. But, you know, our society doesn't really acknowledge that yet. So,
and I find that even when they do, they put the
responsibility
onus
on
race, right? It's like, it's race, not racism, that caused the issues. As if like we were just naturally predisposed to all of these concerns, and that there's no social context to be creating these, this disparity.
Cancer, like there's certain cancers that Black women are much more susceptible to having, and so they don't make the connections, and so I think it's connected. So for me, it's connected, and we need, if we don't target these social issues that affect our communities, you know, if we don't target the racism that affects our community, the policing, the surveillance, it's going to continue having an impact on our physical health, on our mental health, on our community, health. And so, yeah.
So, you know, over the last, I don't know, let's say 2-3 years, whatnot, there's been a resurgence of racial awakening, and I say resurgence because we know these things are cyclical, and then people get tired of talking about Black people, and then it comes back every decade or so. So this last resurgence of racial awakening, has it shifted things in a way that you find are significant? Are there like initiatives that you're really excited about? Do you feel like we've moved forward? Where's your, if you had like a pulse check of how things are going, how do you feel about it right now?
Honestly, I don't because a lot of people talk a lot about before George Floyd, after George Floyd, and I understand, there's a lot of programming that has come out, after post George Floyd, and organizations that have released funds for Black programming and everything. But for folks like you and me that have been doing this work for all of our lives, it doesn't really. Sometimes I ask myself, does it change things for white folks because they have more like spaces now to talk about the issue? But for folks that are doing the work, like I can't really say that it's changed much in terms of the work that I do or how I do it, because and sometimes it's even counterproductive because sometimes it's just so performative that whether it be and I know Indigenous folks face the same. There's certain gains in terms of acknowledgments from our governments, but a lot of times it just leads to a lot of performance and performativity and not real lasting change, transformative change. And that's what worries me. Like I need to see the transformation before I buy the whole
Yeah, for sure. I feel,
because they'll give us money, but then they're gonna say they're gonna put police in the schools.
A little bit of balance. You can't have too much transformative change at the same time. You gotta balance it out. One of the things that I find is interesting about these shifts whenever they happen is that I think it has more of an impact on popular education than it has an impact on institutions and systems, which for the most part, I think continue kind of doing either performative work or, the cogs are still kind of like, very much lacking oil and are not moving as quickly as I would like to see it. But what I do see sometimes though is that it'll give a burst in terms of general understanding, right? So even when we were doing this like vox pop on the street and asking people about concerns in terms of like Black community and so on, there was more people than I think I would have encountered before who were able to even formulate a thought about what they think is happening to Black communities than say if I had had this conversation with people on the street 5 years ago, where they wouldn't even it wouldn't even necessarily cross their mind. And so then I wonder, and I'm asking you this, if you find that if we elevate like the general population's education around this thing, around our concerns and so on and so forth, do you find that then trickles into your work down the line? Like, is that enough?
So you have to remember, we're talking about a society here in Quebec that the government can't even acknowledge that there's systemic racism. So I'm still waiting for the conversation to,
rise to a
baseline. A baseline level. So that's why I say, like, in the context of, in terms of Canada as a whole, yes, but in terms of where we live in Quebec, I think there's so much work to be done still. And so I can't depend on them to get their shit together. We still have to do the work that we have to do for our community. And so I think that's where we rely on allies to do work, because a lot of times it's just,
And it's very exhausting, non-productive work. Like that, I think that's one of the things that I have come out of the last 2 to 3 years of my life, just being like, I can't do hamster wheel work. Like that's just, it's not good for my own health. It's not good for my family health. And like, if we're gonna do any sort of change, I'd rather see it on be slow but consistent and actually long term, versus they kind of like being very showy, but then not sustainable.
Yeah, and also it's tricky because a lot of times, you know, government is coming out with policies that are detrimental to our community, actions that are detrimental to our communities. They just say really racist things, like just this week, or was it, where the ex-minister of immigration talked about migrants here, that, you know, that they don't work and blah, 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 blah. And so, you know, a lot of us are very in a reactionary mode, like we need to react to this, we need to react to this policy, like we're always reacting to something. And that doesn't give us the time to create what we really want to see for our communities. And so that's why I think there needs to be a balance. I'm really glad that there's folks that, you know, there's folks that just say, I can't even be in the reaction because that my mental health it affects my mental health too much. I'm just gonna be in my space, trying to create what I want for my community, and I see a lot of folks doing that. And I think that's really important, because if not, you're always, I remember when I was younger, I was always reacting.
And
I was always mad, and I'm gonna go out, okay, no, we need to do it, and we still need to go out in the streets, we still need to take the streets.
Oh, for sure.
But we need to have energy also to build those systems that we want to replace the ones.
Well, that's the thing, right? Like, there's so many levels to this work, and everyone, I think that there's so many different types of roles. Some of them are frontline, some of them are kind of like in the background, and et cetera. And I think that there was a time when people were talking about it as if it was like personalities, right? Like, you're a firecracker, so you're gonna be a frontline person, and so on and so forth. But what I like in what you're saying is that, like, often it's like it's almost like a rite of passage. Like, we all have a responsibility in many of these different roles. And if we don't rotate, if we don't have a system where we all feel invested in the multiple aspects of this work, then we're really just burning out the very small resources we have, right? Yeah. Like the small people resources we have, because especially in this context, as we know, we are a minority, we're spread out, we're isolated, we're so on and so forth. So you, at the end of the day, sometimes you'll see the same 15 names doing the work over like 15 years, and that's definitely not gonna allow us to have longevity.
Like, I've come to understand that there's different ways of showing up for your community, but I think, like, even if with the age I've become less active in certain forms of action, it doesn't mean that I'm not going to show up, you know, for those actions, because, you know, I think it's important that we value how everyone can show up. And I think it also has to do with our talents. We have to put into, you know, we have to use our talents, and not everybody has the same talents. Yeah. So it's normal that, like, for artists, the artists that use their talents to raise awareness.
100%.
Like, there's a lot of Black artists here in the city that are doing incredible work and, you know, transformative work, and we need to support that. And I'm not, like, I don't have those skills, but I can support it.
You're not gonna sing for us right now?
No. So yeah, I think it's important to show up for our communities in different ways, in the ways that we can.
And we know that advocacy doesn't always just happen from our communities, right? So, like, you touched on allies for a little moment, and allies can be from multiple different communities, other racialized communities, other minority communities, white communities, and so on and so forth. When you're thinking about community advocacy and people who are entering in conversation with Black community health, what would be some of the things that you would want them to know about our Black communities before they start working with us?
Well, that's a tricky question. So, like, for me, I used to do a lot of coalition work, and I still do, like, in the context of the coalition but I think that's the only coalition work that I do right now in terms of the work that I do, because for me it was very, very exhausting, in the sense that doing coalition works, the needs and the experiences of Black folks usually went to the bottom in terms of priorities. And I got tired of having to fight to center the needs of Black folks. So at the end, I just decided that I was gonna concentrate my efforts and my talents for my community. And that doesn't mean that you don't do coalition work sometimes. You do. but my focus is for my community. And so, and I think there's ways that people can support without, you know, because the problem is a lot of times it takes a lot of energy to always be, sometimes you have to like walk them, you know. It's very, you know, it's very, how can I help? Like the famous question in every panel. So, you know, I want to be an ally. What can I do to help? And it's a very like, it puts the responsibility on us. So I think that needs to change. We need to find ways of working with each other and doing coalition work where the burden and the work, most of the work doesn't fall on us.
Well, you know what's also so interesting about those questions is that it's with an assumption that we actually understand the systems that they're coming from. So often when people would ask me like, well, what can I do as an ally? I'm like, well, I don't actually know your organization as well as you do. So like, you could tell me what like can be done because you actually know the system that you're working in, you know your community really well, you know your organization well, and so on and so forth.
But sometimes it's individuals that they just stand up with the best of intentions.
Yeah, for sure.
And they say like, but that maybe they have an awakening and they say, oh my God, we're participants in this, you know?
Yeah.
And they're like, what can I do? But sometimes they stay in that, what can I do? You need to tell me what to do, you know? And it's a lot of times it's a lot.
No, for sure. And as if there isn't other ways for people to get educated.
Like start with your family.
Oh my gosh, literally. And I mean that like families is a big part, right? You know, when we were talking.
You need to start with your community because a lot,
100%.
and I think that's the main complaint. A lot of times people that are not from our communities that want to be in solidarity, they want to just dive into our communities. But you know, there's a lot of work. But then when there's work to be done outside with, you know, non-Black communities, they're not necessarily the ones that are the most vocal.
Oh, for sure.
And so I think you need to start with your own community.
And it takes a different type of bravery to show up to Black spaces. And I know that it takes like a bravery to do that, right? Versus to speak up to, sometimes, you know, for some people, but then, and it's a very different type of like awareness and bravery and all of the above to do that in your own community, right? And to be accountable and then to then become, I have a friend who's an ally and they've told me a lot about like how the shift of their relationships happened when they started to speak for minority people in those spaces in their community, right? And then they then got pegged as the person who cares about minority people. And so conversations change, your friendships change, people look at you differently, and et cetera, et cetera. And I think a lot of people are very afraid to take that on, right? Afraid to be like, oh, well, like everyone's gonna, you know? And it's like, but that's
say that they're
exactly, and that's really, I think that where the discomfort is where actually the allyship begins, right? Because you can't be like, I'm an ally, as long as it's like very cushy and very nice, and no one's gonna say that it's like, you know, no one's gonna question me, no one's gonna, you know, like that. I feel like that's the leap that people are afraid to make without, you know, acknowledging that this momentary discomfort that you're having, we have, like, it's like literally the framework of our lives here, right? So. Yeah. And now, on the reverse, if you were to think about what you would want Black community members to know about community organizations, to know about community advocates, about community, what do you want our communities start thinking through and have at the forefront of their mind in terms of getting their needs fulfilled?
I just think, as you know, as Black folk, we need to better value the work that our community members do, because we have this idea of what is a community activist, or what is a community organizer, or who's doing this work. And there's so many people doing important work. It's just it's not really valued or visible. But you know, especially Black women, all the labor that they do daily with, you know, their families, with their community members, which is not just which is ignored. And so I think we need to start valuing community and community work, and we need to start looking at it differently. It can't just be the work that is visible, you know, the folks that are on TV or the folks that are doing conferences. It has to be also, like, we need to protect and we need to value those that are doing the work that's invisible, the work that, you know, nobody writes about, that nobody sees, but that is doing a very, you know, that's making change and, you know, making a difference in the lives of our community members daily. So that's what I would like to.
I love that, because there's so many things that I hear when I hear you say that. So one, I hear like the valuing of our community members, which I think also like helps with the burnout that we're seeing from our Black women and so on and so forth. Like there's when you value, you also invest and you also care for and so on and so forth. So that's one level. Another thing that I see, what I hear is this idea of longevity of what is being done, right? So if we actually valued, let's say, the ways in which our Black community members are mothering, are doing elder care, and et cetera, then we can build on it, right? And see it as important, right? As opposed to kind of, I think that there's this, like there's almost like a lack of acknowledgement that we're doing very intentional work. Like when we raise our children to be strong and love themselves and care for themselves in non-Black spaces, that's intentional work. It's not just like I'm a good mom. It's not like, it's like, no, like I really have to think about this on a day-to-day basis. Like, how am I gonna best equip this child in this world for them to be able to survive, to thrive, right?
How am I gonna undo all the damage that's being
on a
done
daily
in
basis,
school?
right? And that is, for me, that's a theory. Like, don't tell me that that's just like, I woke up like this and I like, you know, like there's a lot of theories, practices, and so on and so forth that are almost like are completely unseen really at the end of the day, right? Like what amazing radical work is happening there when we do that for our children, when we think about our elders, when we think about our sisters, our men, and all of these things that we do on a daily basis that doesn't get valued as star activism, that doesn't get seen as a framework, doesn't, you know what I mean? And how could we then invest in it in a way that actually is a framework that can be passed on from generation to generation, and we're not like all starting from jump, you know? So in one of the past interviews that we had this week, we were talking about you know, birth workers and supporting Black birthers in like health institutions and so on. And it's like, do we have to reinvent the wheel each time that somebody's supporting, or can we actually value that and be like, actually, the way in which Black birth workers have been doing this for generations is actually really important, and that should be part of our kind of community knowledge. Yeah, so I really appreciate you kind of bringing that to the forefront. And it's a nice segue to start to talk about the many different ways in which I know that you do caregiving. And I'd love to talk about, you know, as a caregiver for many different contexts, right? Whether that be in your personal family or in community and so on. How do you fill yourself up as a caregiver? Do you find that you have a community of care that checks up on you as well? Or are you kind of in this, you know, extractive relationships with care where often you're caring for others and that's not necessarily being reciprocated?
So I guess what I would say is when I moved here and I started getting involved and, you know, started doing, you know, rallies, doing visible work, I quickly realized that I needed to protect myself, having a solid group of community, what, you know, I consider my community around me that know me and love me beyond me being an organizer or the work that I do, and then know me, you know. Because a lot of you know, I was talking to a youth the other day, and we were talking about the importance of, you know, being an activist, being an organizer, that can't be your sole identity. You know, that's something you do because you believe in something, you're trying to create change and you believe in that change, but that can't be your identity, you know, and you can't let people just appreciate you just because of the work that you do. And so I'm very intentional of surrounding myself with people who don't care.
They're like, oh, you were on TV? Oh, we're in bed.
Don't care at all. And I'm like, my kid does not care. You know.
Oh, I mean, this is why we have children, so they can keep us humble, you know? Like, you out here, you thought like, ooh, I went to this conference. They come back and they're like, yeah, where my snack at?
Or, you know, like, I'm very intentional. The people closest to me are people that either knew me before I was doing this work specifically, or even if they knew me after, like you, don't care. And that, like, when we spend time together, we can just be us and talk about other stuff besides the struggle, because that's community care. We can't just always be thinking in that type of mode, because we're gonna burn out. We're not gonna be able to take care of our health. So it's important, you know, to also value our being outside of, you know, that, you know, the public figure or the organizer, or, you know, it can't just be that. It has to be also about, you know, about us. So.
Yeah, for sure. And you know, I really feel like, it kind of echoes what you're talking about in terms of how we see community, like a community in this North American context is often synonymous with community organizing rather than the actual people, you know? Like we both, you know, as Hispanohablantes, when you say pueblo, you're not just talking about like pueblo, the structure, right? You're talking about pueblo, like people.
Yeah.
Like it's really about your people. And I think that very much gets lost in a context where we're constantly fighting for rights, and I can understand why the structure takes a forefront in a lot of different ways, but remembering to not lose ourselves in that, right? And why are we even doing the work at the end of the day, right?
And it's kind of, you know, like I've said this before, and a lot of times people are surprised, and it's because it is disappointing in the sense that if there is a community of organizers, we should be, you know, looking out for each other, but it's not always the case, because everybody, you know, it's difficult. We live in a society where it's difficult to have community, and so that from the start. And then when you're surrounded, when the work that you do is visible, there's a lot of stuff that comes with that, and it's hard to, it's even counterproductive to having or nurturing that sense of community. And so while there are, like, I'm not saying there aren't any people I organize with that I consider part of my community, there are, but like the vast majority are people that like know me to the core and know me and know that like the fact that I organize or the work that I do is like a small part of who I am, which is important, but is not all that I am. And because I think that's important, because I've heard so many stories of Black women who are organizers or who were like leaders in their community, and once they stop organizing because of health, because this, you know,
straight up,
this like can kill you, they're forgotten. They're forgotten. And you know, there's GoFundMe's to raise money for this and for that because they're just forgotten.
Yeah.
And so that's what like really opened my eyes. And I think it's important specifically for Black women, because a lot of the work that we do is you know, I think sometimes the work is ungrateful, you know?
Oh, it is the most ungrateful.
and so I think it's important that we have a community net that is there even if we can't do the work. Because it can't, you know, I think it's not fair that we only show up when, you know, when the work is visible, when we can do the work, because we're not going to be always, and the point is not to be always doing the point is to have, you know
I'm all about passing the torch.
Yeah.
Always.
So when we pass the torch, does that mean that nobody's going to care for us?
Oh, true. I mean, unfortunately, I would say yes. I would say, at least in my experience, you know, when I think about the many times I have passed the torch, because that's kind of my own health practice is to, I usually, like, I'm a little bit of like, I have a lot of that startup energy, and I'll help when things are like urgent and get that going, and then I have to pull out because once you know, it's not sustainable for me. But then I get forgotten for sure. You know, I get forgotten, have had to change completely different communities of connaissance, really, because I wouldn't say that they're like meaningful relationships because they didn't make it from one side of me to the next side of me. And yeah, no, it's really, and I've seen it happen, like you said, very much so, particularly to Black women, that unless they're useful, they're no longer part of who we check in with, who we hang out with, don't get invited, and so on and so forth. It's only really when they're able to kind of give in a very specific way. I also wanted to talk about how we learn to be caregivers, and I know a lot of the time it's literally just out of necessity. Like I know that like part of how I learned how to be a caregiver for a child is because I had one. My mom was because she's aging. Like, you know what I mean? Like those things we kind of learn in the thick of it. But you know, in an ideal world, like how would you like to see this knowledge transfer be happening, right? Like, is it? I know there's like a bit of a push towards. I don't know if I have an issue with it, but I know that it's. Sometimes I get, like I have a difficult relationship with money, and though I know particularly living in this North American context we need money, but I do see that there's a packaging, I wouldn't say commercialization, but a packaging of our knowledges as things that are exchanged with in terms of money, right? So like whether that be trainings of like, this and that, and it's like, and it's for our own community members often, right? Of like how to do, I don't know what X, Y, or Z, like social justice, whatever the training is, and we're teaching each other on things that really at the end of the day belong to us and have belonged to us, but unfortunately got lost in translation. And then so we package it to each other for a fee. And I can understand, you know, if like this is like the person is an entrepreneur and this is how they make money, I get that. But often I feel like it's happening as like the main way to do knowledge transfer. And I don't necessarily see as many other forms of just like natural community mentorship or, yeah, like the different ways in which this would happen if we were in Haiti or in Cuba or in, you know what I mean? Like where knowledge would be transferred literally because you're following them around, and so you see them do these different types of things. So in your ideal world, how would we be learning about these ways in which we live in this particular world?
Girl, is that the last question? Because that's a big question.
That's a heavy one. I threw it on.
You should have put it at the beginning or in the middle, not at the end. It's really difficult because, you know, I'm Cuban, so that's like a lot of things to unpack. Like for me, it was very, very, it was a shock because the work that, like when I started organizing very young, like in 16, 17 years old, then university, you know, I did my university in Puerto Rico. We were fighting to get the Marines out of the island. You know, we were doing civil disobedience. Nobody got paid for anything. Mm-hmm. And then I left, I came here, and at the beginning we would do panels. Nobody would get paid for doing panels. But then there was a sense that, you know, that a lot of times I said nobody, that's not true. Black women wouldn't get paid.
Yeah. Bottom of the food chain.
But like a lot of times I saw that there was, you know, in this context, other people would get paid. But then, you know, when people started getting interested around intersectionality and wanted to hear about Black feminism, and you know, it was like trendy, Black women would start getting invited to talk here and talk there. And so, and they weren't being paid necessarily. And so I think there was an awareness that, you know, in the context where we live today, and especially when it's not, this is not for community, you know, when we're being invited, it's like the university or, you know, someone's classroom or a community org that's not from our community.
Our people, for sure.
So I think it's really important to pay for one's labor, and I think it's a form of reparation too. So
yeah, 100%.
I don't have an issue with that. I just think we need to have conversations on what type of work, you know, like when we're doing a lot of times, and I think it's something very personal too. I don't know how to answer this question because I don't want to say what others
like
should
one
do.
format.
Me personally, I do things free for my community. Like for especially if I know there's no budget, like I'm not gonna do it because you don't, you know.
But you know what, I think it also ties into this idea of what community is in the first place, right? Because if we're saying we're doing it, let's say we're using your framework and it's like we're doing it for a community because that is free, but is it like a community org that got a bunch of funding to do this thing versus
that's what I'm saying. If there's no budget, because I think the thing is people are used to seeing Black women not get paid, and it's become normalized, and so it's like, oh, like even if there's a budget, oh, you're a Black woman, so it shouldn't be a thing, and that's like no. That shouldn't be a thing, and we should pay for people's work, especially because, like I said, it's different. It's tricky for me because I came here as an adult. I was not born here. I was not raised here, and so I know that, you know, culturally and in terms of the system that we live in, people need to get paid for their labor. It's you know, it's a value system. There's a value system in that, and I don't have a problem with that. It's just the commodification of social justice, the commodification of liberation movements. That's what I have a problem with.
And it's also taking a very specific format, let's say. At least that's what I've been noticing. So I think about how I grew up and because I was born and raised here, you know, I wasn't in the Caribbean, and how I grew up and how like community activism, not social activism, but very community activism was passed down to me was literally because in my dining room, my mom was always having meetings with all her people. They were they were there, you know what I mean? Like, so I learned like en babouche, you know, just like literally because you're there and you happen to be in the space, or she'd take me to the radio station with her, or there's like all of that. And then my aunts would do that and my uncles would do that. And you know, we have a very fluid understanding of what aunts and uncles means, right? And so there was a lot of knowledge transfer that was happening just by being in these spaces, and not this like formulated labor format of like, I'm gonna create this training, you are gonna take this training, or you're gonna come to this talk, or you're gonna do this, and et cetera. And that is something that can be commodified in a really different type of way, you know?
But I see this happening, so I guess the way to answer this question, now that kind of in my head, is that is in the context of like what we call the non-profit industrial complex.
Yes.
I mean, you see how I use big words.
You got it.
Because, you know, we live in a context, we live in a society, neoliberal society, capitalist society, where everything, like social needs, health needs is commodified. And so we have community organizations where people, you know, the work that they do in community organizations is often professionalized. Now you have to be like social worker, you have to be this. So it's not really, so that's why I'm saying when we say community, well, what are we really talking about? Who's part of that community? Because for me, these are institutions.
Yes.
You know, it's the institutionalization of community work.
Yes. 100%.
And so people are paid to do that work, and then you're bringing other people to do work, and they should be paid too.
And they should be paid too because they're part of
So
this,
in the context of community organizations, that's what I'm saying. If they have a budget, they should be paying people for their labor, even
100%.
if it's like a anti-racism training, or if it's whatever training it is, and even if it's a Black community organization.
Yeah, for sure.
because they're getting, they're in that system. Where I have an issue is where that, extends to liberation movements and nothing can be done outside of that framework.
Yes. And
That's where I find that there's a danger because, it's the commodification of our liberation movements, and
Yeah, for
that's
sure.
really-
And then it also pinpoints very specific experts, and we know like that this will then be the star activists. Often it'll be our males. Often, there's a lot of things that happen when we do this like professionalization of like very grassroots, in your kitchen kind of work. As soon as it leaves the kitchen, it's a very different person that they put to the face on that.
But there's still folks that are working outside of that framework. But that's one of the dangers, because when I came here, I worked in I've organized with BLM here in Montreal. I've organized with other anti-racist collectives. I've organized with feminists, and not been not in a context where it's an organization and you have people that are staff and are workers. No, it's like we're all organizers, and we do this without being paid.
On top of all the other responsibilities.
Exactly. But, I don't see it, if we need resources, I would say it's often because we need to feed people, because we need to help people, because we need to get people out of jail, because we need to pay lawyers. That's why we need money. But I don't see, in terms of that type of work, because it's not a community organization. It's organizers that are doing this important work. I fear that there's going to be a professionalization, and then it's going to be commodified, and then nobody's going to want to do anything if it's not in
this framework. And then also
context.
even just when it comes to getting grants and whatnot, well, how long has your organization been around, and how all these things that kind of create like you said, this industrialization of our social justice movement.
But what ends up happening through the professionalization is that the folks, if it was a collective before and it then becomes a community org, is they get even further away from the
community they serve at the end of the day, really. You're such a wise one.
Really? Are you sure?
Yes, I am. I'm 100% sure. How do people stay in touch with you? I want to know what's the best way, social media, online. I know you have a website. Can you tell people a little bit of how they can stay connected with your work?
So I have an office.
Here on campus.
Concordia's
own, Marlihan Lopez.
2155 Guy Street at the Simone de Beauvoir Institute. You can look me up on Concordia website. I have my emails there.
And lots of pretty pictures.
Or if not, you'll see me on the streets. You'll always see me on the streets. When you don't see me on the streets, be worried.
Look for her. Don't let her be forgotten, everybody. Thank you so much for chatting with us today.
Thank you.
Okay, well, I guess I'll just take a note. I'll take a moment, to make a note to say it's pretty impressive for us here at Fourth Space to give people two semi-comfortable chairs and a couple of mics and maybe a little tiny glass of water and see how the conversation sort of evolves. And we've certainly witnessed that this week with you, Annick, and the folks that you've brought in. It's been tremendous, and I'm so excited that we've been able to work together to make this happen and to have these conversations live on for others to experience them down the line. So thank you so much, Marlihan, for coming in, and Annick for being here with us daily this week and making all of this come to life, really. Folks, thank you for joining us on Zoom. I hope you enjoyed the conversation, and if you'd like to revisit anything that happened this week, just go to Concordia University's Fourth Space YouTube channel and you'll find the streams available there. On that note, we're going to bid you a great afternoon and talk soon. Bye, everybody.
Bye. still maximum.
I don't know.